Alright, so this is my reflection on week 2 on maternity 2 ward. So first of all, the procedures that I've done for CTG, abdominal palpation, assist in vaginal examination, and also transferring patient from the maternity 2 ward to the labor ward. So first, the procedure that I've done the most, especially was CTG and also abdominal palpation. So for the strength that I gained in this word is that it has been a great exposure for me towards the pregnant mother because of their period of gestation, and I am able to do the abdominal palpation and also to feel the movement of the baby and also the presentation of the baby. And also it enables me to practice more on ONG procedures, and also the sister and the staff nurse in this ward are also kind and also help us a lot in doing procedures and taught us too. So for weakness, we only had 4 days of processing, so it's quite short and we didn't manage to see a labor procedure because of the short period of time. And then we also not being attached in the labor ward, we only can transfer patient to the labor ward. I think it will be a great experience if we get attached in the labor ward. And also being a nurse student because yes, all of the patients are women and they are quite uncomfortable when I do some procedures on them, especially like assisting in vagina examination. Overall, it is a great exposure in this maternity ward. Thank you.
So the procedure I have done in maternity 2 is TCM, CTG, abdominal palpation, ward duties, and transfer patient from ward to labor room. For overall strength, and what I have learned is when there's abnormality in fetal heart while doing the CTG, I will directly inform my CI and staff in charge so that they are aware of it. And then I perform the CTG according to time and as ordered by doctor. If it is that, if patient complain that their membrane have rupture, I inform the doctor and staff in charge. Overall, I think my communication with the staff is good. And if I am sure about something, I will directly ask the staff or my supervisor for clarify. If there's new admission, I like to assist with observation. And lastly, I learn how the management of transferring patient to labor room when the patient is ready to deliver a baby. Like when first they need to do VE if the patient complain of unbearable pain and prepare for a room and wait for the confirmation. Lastly, they will transfer the patient from the ward to the labor room. For the weakness, sometimes when I do the CTG, the reading is a bit different from previous result. So I'm not sure why. Second, I'm not confident while doing the TCM because I cannot feel the contraction strength except the very strong contraction. And then I feel anxious every time the patient said they cannot hold the pain anymore and ask for painkiller. And lastly, during Friday, I'm unable to detect the deceleration of fetal heart of my patient in my cubicle. However, the sister in charge noticed that it's abnormal and then asked the doctor to do VE. The patient undergo emergency surgery due to fetal heart crypticus.
My name is Zainab Binti Sofian. So this is my reflection throughout 1 week in maternity 2. So this is the procedure that I have done. The first one is basic nursing care, CTG, DCM, abdominal palpation, assist in vaginal examination, teach deep breathing exercise. For the strength, I am able to maintain strict hand hygiene and follow current SOP. I am confident in delivering the basic nursing care to patient, able to document every procedure in the right chart, and able to inform the staff nurse if there is any abnormality detected. For the weakness, I'm not sure to determine the presentation of baby during abdominal palpation and sometimes confused between the real contraction and baby movement during the TCM. That's all. Thank you.
This is my reflection. My name is Rizkana Clement. Procedure that I have done is monitoring of uterine contraction TCM. For the strength is I able to detect the time when the mother having contraction. I also able to differentiate between the contraction and the fetal movement. For the weakness is I have a hard time to calculate the duration of contraction, and I also easily distracted when doing the TCM. Second, cardiotocography (CTG). For the strength is I able to locate the positions of fetal heart probe port and uterine pressure probe Tocco port well. For reference, I don't know when the time that we should stop doing the CTG. Next is abdominal palpations. Progesterone is able to palpate well, able to detect the baby presentation, slide, and positions. Weakness is no weakness, and we are familiar doing it since community. For the fetal heart rate, the strength is we able to detect the abnormality, and for the weakness is I take a lot of time to doing it. And then I also have a chance to assist the doctor in vaginal examinations, and also have a chance to watch the spontaneous vaginal delivery at the labor ward.
Hello, my name is Farah Miza binti Hadik, 60762, and this is my self-reflection report for week 2 in maternity ward 2. In this ward, I was able to perform TCM, abdominal palpation, deep breathing exercise, insert CBD, and supervised breastfeeding. For TCM, I know what I have to do to perform it. However, I'm not sensitive to the feel, especially the mild and moderate contraction. So I need more practice to be excel in this procedure. Next is abdominal palpation. I know what I have to do. However, I'm not sensitive to the feel that make me becoming unsure of the position of the fetus, especially GDM mother. So I need more practice in this procedure. Then deep breathing exercise. I can instruct the patient correctly. However, I am becoming unsure of the effectiveness of this procedure to the patient. So I should reevaluate the outcome from the patient from time to time. Other than that, insert CBD. I know what I have to do in order to perform it. However, I have poor planning. This is evidenced when I breach the sterility by crossing over my hand to the other to throw something in the yellow bin. This should not be happen, so I should plan ahead of time so this incident would not happen again. Lastly, supervised breastfeeding. I know the right method to instruct patient on how to perform breastfeeding correctly. However, I require help from staff nurse to instruct the patient, especially the primary gravida mother. In order to overcome it, I should be more proactive in my approach to instruct the patient. That's all from me. Thank you.
Hi, this is AB Bridget Anak Joseph, CAT Matrix 63005. The procedures that I've done in maternity ward 2, firstly, performing basic nursing care, which are vital signs, perineal care, denture care, bed making, and transferring of patient to another unit. Next, performing health assessment on the patients. After that, assisting in inserting urinary catheter. And lastly, performing obstetrics and gynecology procedures, which are manual monitoring of uterine contraction, TCM, performing electronic fetal monitoring, EFM, or cardiotocography, which is known as CTG, check and monitor fetal heart, assisting in vagina examination, performing and monitoring fetal kick charting, supervise breastfeeding, examine pregnant mother, performing abdominal palpation, and measuring fundal height. My strengths are, firstly, I prioritize patient safety and patient-centered care approach in nursing care. I'm a team player and communicative to my colleagues, staff nurses, and also to all my fellow doctors. And also, I'm able to document every procedures in the right chart. I'm confident in delivering nursing care to patients. I'm proactive and hardworking. And not only that, I'm able to perform health education to all of my patients. My weaknesses are I'm too empathetic and sympathetic to the patients to the point that it hinders me to perform some procedures. For example, I have a difficult patient who is uncooperative because she's experiencing uterine contraction. And because of that, I have to stay with her for 20 minutes and comfort her during those times. Not only that, my performance in the ward is heavily dependent on my mood. If my mood is not good on that day, I'll probably not do too many procedures on that particular day. And at times, I'm disoriented and blur with the ward routines. For example, during Tuesday and Wednesday, I've had PM shifts, so I do not do any bed making. But then during morning shift, I forgotten to do bed making before performing vital signs. Luckily, I have my colleagues who is there to assist me to do bed making and tell me what to do during the morning shift. And lastly, I take time to adapt with new environment.